Hello, it's good to have you back in our series regarding case acceptance. I bet you thought I was going to say welcome back. Pfft, typical you to think that. It's so you. This video is also in our treatment coordinator series. This is because it is equally important for both parties. You will recall that we suggest that the treatment coordinator sits in on new patient exams, especially when that treatment coordinator and doctor have not had an extremely long and tight relationship. That said, in practice, this is not always possible. The treatment coordinator may be busy with other patients. Additionally, there are diminishing returns in sitting in for exams after the treatment coordinator and the doctor have established a pattern of thinking and communication that is very much similar. If the treatment coordinator is not physically in the room during the patient's exam and subsequent discussion with the doctor, there are a few things that are crucial for the doctor to articulate to the treatment coordinator. You simply can't expect the treatment coordinator to present the same treatment to several different patients and do it in the same exact fashion. Everybody has different needs, desires, and values. And if you present everything to everyone in the same way, you will reach so many fewer patients. So we're going to start with an example. In this example, I'm the doctor and I've just finished an exam with the patient. I let the patient know what the findings are, and together we have decided on a plan to move forward. The patient understands the general outline as well as the sequence. Now I've left the room and I've printed out the treatment plan. I will hand the plan to the treatment coordinator and then discuss the case with them. So, you're about to go into a consult with Sandra. She's a 62-year-old female. She has neglected everything for way too long. She cried a couple times during the visit because she's so mad that she has let things go so far. I asked her to simply look at the future, see this as here, forward, and not look at the past. So look at the radiographs here of 6, 7, 10, and 11. You can see how huge the lesions are. She has taken bisphosphonates and she understands that nobody will pull these teeth without hyperbaric oxygen chamber therapy, and that will exceed the cost of any dental treatment we could do. So she knows that we have to be aggressive in order to save teeth. So for your info, the importance of this is like second mortgage her home type of stuff. She's totally motivated to do this, and as long as she can afford it, she desires to move forward. I'll do all 4 anterior endos, post and core, and crown preps in one shot if she wants. She knows that I would be setting this time aside specifically for her, so she can't make this appointment without showing up. Please stress that again though when you talk to her. If she waits more than a month, her treatment plan will likely change. The caries are that large. I need a week after SRP before I can start the restorative work to give her gingiva some time to lose that inflammation. I need 4 hours for the first large restorative appointment. I'll do $4,600 total for the first visit if she's sure she can show up. That is an incredible deal, but she's got to fulfill all these requirements. I recommend Valium 10 milligrams for her 1.5 hours before the appointment so she can just kick back and truly relax. I know she's pretty nervous. Tooth number 14 is planned for an implant. She did say that she wanted to think about that. I've put it on a separate treatment plan for her. So, now the treatment coordinator now has some history on the patient. They understand where their motivation lies as well as what has gotten them to this point. They understand the nature of the problems, the relative urgency, the options to fix it, why the treatment plan that was chosen, why the alternatives were not chosen, what was discussed with the patient. Radiographs and photographs have been reviewed. They know what barriers may be encountered. They know the patient's personality. They're coached as to the strategy to use when discussing these things with the patient. They know what will happen if the patient does not treat the issues at hand. They have been provided with any financial arrangements if there have been any. They know how long you need for the first visit. They know the sequence, the relative time frame from start to finish, and many other details that will help them. So we're going to provide the list of kind of the criteria of what you're going to want to accomplish here in our supplemental materials. So don't feel like you got to write everything down we just went over. This process should be something that you do with total discipline. Is this extra time and effort? You bet it is. I can tell you, however, that this can be one of the single biggest improvement opportunities in your case acceptance. If you don't do this, your treatment coordinator is completely flying blind. Don't make this mistake. Take the time and the effort to do the right thing, you bully. Thank you, everyone. Have an awesome day.